In the US, according to the CDC, about 1 in 10 babies are born prematurely. We're saving babies earlier, so our NICU census has been higher than it has since I started working there. The therapist I had was seeing 1 baby, and now we have maybe up to 16 on our caseload, with more babies being born earlier, which means that their NICU stay is longer. Every week that they are still in the womb is beneficial.
So babies start sucking and they swallow amniotic fluid when they're in utero. The component that they don't have is they're not breathing. They are not integrating breaths into their suck-swallow sequence as a term baby would. A lot of times, babies that are advancing slowly or not able to get to their full oral feeds, that's going to keep them for quite a bit longer.
The NICU journey is a journey to discharge. Our whole goal is basically to finish that gestation, or I love the phrase, assume the womb.
The awesome thing about the N-Trainer is that it helps babies learn to integrate their breaths into their suck-swallow sequence. And when they are orally feeding, when they're at breast, you can't add pacing breaks in. The baby has to take those breaks on their own. In the assessment mode, it is measuring the baby's sucks and suck pattern, and it is not giving the baby any stimulation. It's just measuring what they are doing.
The therapy mode actually stimulates those sensory nerve endings through pulses, and those pulses lay down patterns in the brain so that they're safe feeders once they're able to orally feed.
The QI study that we did in our unit did show reduced length of stay, reduced time to full oral feeds, reduced use of thickener, and then we showed post-discharge reduced therapy needs.
And we also saw, it seems like the babies had less feeding alarms. And then we did look at some data to show that that was actually indeed happening, that there was less feed alarms after we started using the N-Trainer.
It really gives you a quick way to show a baby's assessments to nurses, to physicians, to other therapists, to let them know where the baby's at in the readiness to begin feeding.
It's not difficult to see or understand the visual that it provides with the assessment. I feel like that especially is intriguing to dads who are numbers related, and they're asking, when are you going to do an assessment again? We had one baby that was transferred to our hospital that had been born in another hospital, did not want anything in her mouth, did not like to suck on the pacifier, was very averse to anything in her mouth. We started the N-Trainer, and that went really well, and she did great with orally feeding when it was time.
Having the N-Trainer and being one of the first units in the Pacific Northwest to have innovative technology like the N-Trainer has been something that our whole team is really proud of.
What we do in the NICU is about keeping the babies alive, but it's so much more than that. So much more research recently is really pushing that all care is brain care. We're building those brains, but then those babies become toddlers and they become children and teenagers and adults. And the way we can not just protect their brain, but promote their brain development has impact for the rest of their lives.